Okay. Thank you all for joining us this morning. I wish I could say the moment we find ourselves in today is unprecedented, but unfortunately this isn't the first time Republicans have shut down our government and manufactured a crisis for our communities. And it is a crisis indeed. A crisis for the 29,000 people in my district who will have to pay more for health care. A crisis for the over 35,000 residents of the Massachusetts 7th who could lose their coverage entirely. These are not just abstract numbers. Today, as I revisit phone calls and emails and letters that have been sent to my office, I'm thinking of a grandmother in Dorchester who is already skipping meals to pay for her prescriptions. I'm thinking of a young mom in Chelsea who told me she doesn't know how she'll afford her child's asthma inhaler if her premiums go up and the Affordable Care Act subsidies expire. I'm thinking of the federal contractor in Somerville who's already living paycheck to paycheck and may not see a paycheck at all. Or the custodial worker who was sent home Tuesday night without any hours on their schedule, unclear when and if their next paycheck is coming. We are now on the third day of a Republican-manufactured shutdown. And the hurt and harm is being felt all across our district, with workers and families seeing their lives and livelihoods threatened thanks to Donald Trump. But instead of working with Democrats to do their job, to fund the government and address the health care crisis that they created, Republicans have chosen to shut down the government and to push a terrible bill that will push health care out of reach of our families. So while Republicans move with contempt for the people and push our country into a dangerous shutdown, I'm centering today the people most impacted and fighting daily to reopen the government, keep essential services running, and to mitigate the shameful health care crisis Republicans created. That's why we're holding this emergency meeting today. It's also why I'm reintroducing legislation with Senator Tina Smith of Minnesota to secure back pay for the thousands of federal contract workers who are facing furloughs and missed checks thanks to this Republican-manufactured shutdown. Unlike federal employees, the thousands of federal contract workers, including janitorial, food, and security service workers, have no assurances that they will receive back pay to make up for their loss of hours and pay during a shutdown. So our bill would help ensure these folks are made whole. Let's remember, Republicans control the House, Senate, and the White House. They've been telling us all this time that they have a mandate. Well, do something with it. This GOP shutdown was entirely preventable. They keep talking about this mandate that they have, but they have yet to do a single thing with this so-called mandate that actually helps people, instead of enacting more hurt and harm. So we're calling on Republicans to stop playing games with people's lives and put forward a budget that reopens the government and addresses the health care crisis that they created. Democrats are ready to do just that. Ready to keep the government open, ready to protect families, and ready to mitigate the harm from this Republican-made crisis. So the ball really is in the Republicans' court. Again, I'm so grateful to everyone who joined us for this emergency meeting. Thank all my partners from our community health centers, our healthcare providers, federal workers, and anti-hunger advocates for being here to make the impact plain and to reiterate the urgency of this moment. I know I was referencing some of the incoming that my office has received, and I did want to share a message, not from a constituent, but from a federal worker, and it is as follows. Thank you for holding the line. As a federal employee, I receive calls daily asking if I'm okay. And truthfully, we are. It's a much-needed mental break from an incredibly chaotic and challenging year. colleagues being fired, and now left to tell schools we're stretched so thin we can barely support you. Thank you for holding the line. Although going without pay is a sacrifice, it is a small sacrifice for the greater good of ensuring that more Americans are supported once we reopen rather than being left behind. And with that, we'll now turn it over to Roxana, Assistant to the President of SEIU 32 BJ.
Thank you, Congresswoman. So my name is Roxanne Rivera, and I'm the Assistant to the President of our union, SEIU 32
BJ?
Yes, and we represent contracted workers that work as janitors, security officers, and airport workers, who the large majority are immigrants and people of color here in the communities of Massachusetts. And we believe that Republicans are really hurting the working families here in Massachusetts twofold, both with the shutdown as well as the increased costs to health care for their families. We represent 2,500 workers, contracted workers that work at federal facilities across the East Coast. Some of the familiar buildings here in Massachusetts is the Tip O'Neill building here in Boston, as well as the IRS building in Andover, for example. And even though these workers work alongside other federal workers in those buildings, they are unfortunately ineligible for back pay once the government reopens. And so I do want to thank Congresswoman Pressley for her leadership in introducing legislation that will restore lost income for these families given the impending furloughs or the facing of reduced hours. And I also want to say thousands of our members and their families are going to be faced also with the impending increases in health care. Just at Boston Logan Airport, we have 2,000 contracted cabin cleaners and baggage handlers that already rely on the state for their health care. And this crisis only compounds that and makes it harder for them. And so I'm here to say that it's shameful. It's shameful for Republicans to choose to bring more chaos to working families here in Massachusetts and across the country rather than relief to thousands of working families in Massachusetts. So we do appreciate Congressman Pressley for you holding the line, and we will all do that with her, right, as we fight for the future of families here in Massachusetts. Thank you.
Thank you, sister. Grateful for your leadership. Okay. All right, and now we'll hear from Nick Smith, Vice President of SEIU 1199.
Good morning again. My name is Nick Smith, and I am Vice President of Community Care with 1199 SEIU. 1199 SEIU represents nearly 90,000 essential healthcare workers across the state of Massachusetts. We represent hospital, health center, nursing home, and home care workers. We at 1199 SEIU fight for quality healthcare and good jobs for all. Those are our guiding principles. We have fought for universal health care coverage in Massachusetts, and we continuously fight for increased resources for our employers and our community partners. And now we have to stand together again with our community to fight back against these cuts from this big, ugly bill and this government shutdown. Because of this bill, nearly 300,000 residents in Massachusetts are set to lose their health care. And Massachusetts is set to lose $3.5 billion that's currently going to health care and food assistance. Many of the people who are going to lose their health care, including 36,000 Massachusetts residents, are essential care workers themselves, like our home care and PCAs in our home health aides in our nursing homes. These cuts are especially going to hurt our hospitals and health centers. Many residents are going to lose access to health care, which will mean a lack of preventative care, which will increase our emergency room wait times, longer waits for rehab, more turnover, less staffing that ultimately hurts patient care. Our hospitals are already struggling, understaffed, our ERs are overrun because we don't have the resources or the staff to provide to keep up with the current scare. Once it gets worse, once these cuts go into effect, our institutions are going to see even more and more hardship and struggle to provide quality care to our patients. Now, Democrats in Washington are trying to push back against these cuts, and we need to preserve the Affordable Care tax credits that allow 22 million residents of this country to save on health care. We lose this tax credit, that means our insurance rates are going up, and people are going to see insurance rates up to 75% increase, which is absolutely insane. Republican leaders have created this crisis with their plans to gut Medicaid and health care and take it away from millions of working families. And now they've chosen to shut down the government because they refuse to lower health care. Lastly, I want to address Trump's anti-immigrant policies that really devastate the ability for us to deliver care. Our nursing homes in Massachusetts have a high population of Haitian immigrants who are set to lose their TPS status in January. If they lose their status, many of our nursing homes will be severely understaffed and will ultimately hurt patient care, and patients will go untaken care of and will have to find other means to provide for our elderly family members. I want to thank Congresswoman Pressley for her leadership and standing with us and standing with working families, both in Massachusetts and across our country. With leaders like you, I know we can continue to fight back and push for a better America. Thank you.
Thanks. Appreciate it. Thank you. Okay, now we'll hear from Lily Simmons, the president of AFG 3428.
Thank you, everyone. Again, my name is Lily Simmons. I'm the local president of American Federation of Government Employees 3428. My members work at the Environmental Protection Agency throughout New England. The harassment that federal employees have been receiving throughout this year has been ridiculous. Everyone is going to work with really low morale. We're doing our best to continue our mission to support human health and the environment, and it's really hard. This lapse of appropriations from the Republican-held Congress is another attack on federal workers and all of the services that we provide to the American people. We do this work because it's important to us to ensure for long-term success of our communities. And a lapse of appropriation doesn't help us get there. Right now, many federal workers are actually going to work and they don't know if they're going to work tomorrow. They don't know if they're going to get paid on time. They don't know if they're going to miss a mortgage payment or a kid's school project. It's a very trying time, incredibly stressful. It's very difficult to maintain professionalism in these situations, but every day we're getting up, we're saying our little mantras, we're going out to work, and we're doing what we can because this is what we are put here for, to serve the American people to the best of our ability, and for myself, that is to protect human health and the environment. I thank everyone for being here, and also thank the Congresswoman Ayanna Pressley for putting this together and standing with the communities to provide for human health and the environment. Thank you.
Thank you. Thank you, Lily. And now we'll hear from Jennifer Lemmerman of Project Bread.
Thank you, Congresswoman.
Final word.
Thank you. Right now, families who are already struggling to put food on the table are being hit from every direction. Rising costs, cut to SNAP, and now a government shutdown. I'm Jen Lemmerman. I'm the Chief Policy Officer at Project Bread, and at Project Bread we take a radical approach to ending hunger in Massachusetts. And by radical, I mean we don't just treat the symptoms. We work to solve the root causes, working together with lawmakers to pass policies that end hunger. We run programs that make it easier for people to access food, and we partner with schools, communities, and healthcare providers to build systems where food security is possible for everyone. And we're here today because food is foundational to health. You can't manage diabetes without groceries. You can't take medication on an empty stomach. Hunger and health are inseparable. This shutdown means tens of thousands of federal workers and contractors here in our state are missing paychecks soon. Many of them may find themselves food insecure for the very first time in their lives. And while federal nutrition programs like SNAP are still running for now, the uncertainty itself is destabilizing, and families don't know how long these supports will last. Mm-hmm. At the same time, deep cuts to SNAP are starting to take effect, and healthcare costs are rising. The shutdown is compounding a crisis that was already putting unbearable strain on household budgets. Rent has to be paid. Utilities can't be shut off. So food is the first thing families sacrifice, and that means parents going without meals so their kids can eat. And now, with USDA canceling food security survey, the harm families are experiencing won't even be seen. They will become invisible. At Project Bread, we're preparing to hear from even more people in crisis looking for support to get food. Families and federal workers who've never needed food assistance before may suddenly find themselves asking for help. And while we are here to connect them to sustainable solutions like SNAP and school meals, families should not be forced into a man-made crisis by political dysfunction. We know SNAP works. It helps more than 1 million people in Massachusetts put food on the table and stay healthy, and it's a lifeline families can't afford to lose. For decades, federal nutrition programs like SNAP have had bipartisan support because hunger is not a partisan issue. It's about dignity, health, and survival. Families in Massachusetts should not be collateral damage in political fights. Food is a human right. No one should have to choose between paying for medicine and putting food on the table, and we must protect both health care and food and nutrition services. Thank you. And thank you, Congresswoman.
Beautiful. Thank you. Thank you, Jennifer. I'll give you your sign back. Okay. All right. Well, any questions?
Congresswoman, do you think this shutdown has a different agenda? What do you think the end game is?
Well, to win by preserving health care for the American people. Again, it is not a nice to have, it is a must have. And, ensuring that people can access health care, there should be nothing partisan about that. This is a transcendent issue. So that's the goal. And I would also add to restore the cruel cuts put into effect by the big ugly bill. So restore the cuts to the cruel cuts from the big ugly bill, save health care, and open the government. That's the goal. That's why we're holding the line.
Do you think the strategy to get it back open, does it feel different as a Democrat? Do you have the leverage that you had before?
Well, different from our first fight around stopgap funding, that last continuing resolution, rather, we were not united. But right now, we are united. And again, that was the feedback that I heard from our constituents and Democrats from all over the country. Do not cede your leverage. And so I'm glad that in this moment that we are using that leverage. It's important that we not cede ground, especially for something as important and as critical as health care.
Congresswoman, one of your colleagues, Representative AOC, said she'd be willing to negotiate with Republicans if they came to her door.
Oh, we're all willing to negotiate, of course, yeah. I mean, this is, at this point, listen, every day I go to work focused on centering the people who sent me there, and what can I do to change and to save their lives. What I'm tired of is people in positions of power and privilege and resource, from Jeffrey Epstein to Donald Trump, using all three to exact hurt and harm instead of to actually help people and to lift them up. And so I will sit at the table and work with anyone in the name of progress that will put at the center of their decisions the people who sent us there. Instead, what has happened is that we have colleagues across the aisle who are more concerned with keeping a job than doing it. And that is because of this culture of political grievance and retribution that Donald Trump traffics in every day. And the reason why I'm doing this roundtable, and this is no anomaly for me, I don't say the people closest to the pain should be closer to the power is like some bumper sticker. It's not a shtick. It's a thing I live, and it's a practice for me. And truth of the matter is that I have had constituents not from my district who have Republican representatives who refuse to take their calls, who don't respond to their correspondence, who won't host the town hall in their district, reaching out to me saying, can you take my story and appeal to my Republican representative to actually listen to their constituents? And so they have forgotten the plot, and the plot is the people. And so, again, I will sit and work with anyone and roll up my sleeves if they are serious. But so far, they have proven that they are very unserious.
What other piece of legislation do Democrats have to work with to be able to negotiate?
I mean, we're only 3 days in right now, so I'm not, talking contingency plans. And even if I had one, I wouldn't share it here. But I am an organizer, tried and true, to my bones. And so you're always going to be prepared for different scenarios. But we are 3 days into this scenario and this, premise of what's on the table, so to speak. And the ball is in their court. I mean, this attempt to try to gaslight Democrats and to misrepresent what has happened here, they have the House, they have the Senate, and they have the White House. So they keep saying they have a mandate, so use it. Use it to help people. Don't use it to harm people. And the other thing is, and they just keep their rationale behind this, it's not like I don't talk to Republican colleagues, and they will just double down on their misinformation and propaganda that this is about Democrats fighting for health care for quote-unquote illegals. First of all, no person is illegal. And secondly, reading is fundamental, and they should try doing it. It is already against the law. They are always moving as a solution in search of a problem that doesn't exist. Undocumented neighbors already cannot access health care through the Affordable Care Act marketplace.
Congressman Pressley, you said the ball is in their court. They say the ball is in your court.
Mm-hmm.
Why not just vote for the bill and then keep negotiating and then keep fighting to prevent the government from shutting down?
They have proven themselves to be incredibly untrustworthy. And people are already going to be receiving letters in the mail about these Affordable Care Act subsidies. And so we can't wait. We need to have those assurances now. Again, we cannot afford for the harm that has already been caused by this big, ugly bill to be compounded. We're talking about people who have already had their health care taken away, and now you're talking about people who are insured, but with a doubling of their health care costs, will likely not access health care services because they're going to choose other bills. And again, this is all connected. So you cut SNAP, you cut Medicaid, we have inflation, you have fiscally irresponsible policies, you have chaotic tariffs. And so the environment is so chaotic, so unpredictable, so hostile. People are already navigating so much, struggling to make ends meet. So in this moment, we have to be focused on how to lighten the load. This is why we do this work. This is why we're supposed to do this work, to lighten people's loads and to help them to actualize their dreams for their families. And this is not that. So it's bigger than Democrat or Republican. At this point, it's just about being a decent person and moving with a level of empathy and compassion for your neighbors. And so I'm appealing to my colleagues as people of conscience to stop the harm, restore the cuts, save health care, and open the federal government.
How would the back pay bill work? The bill you work also? How's that going to work?
Well, just again, simply it would just by passing it, it would ensure that those those federally contracted workers would be able to be made whole, because right now they don't have a mechanism. So the protections that exist for federal workers do not exist for federal contracted workers. Roxanne, is there more you want to say? Are you good? Okay.
Looking at specifically the impact for Massachusetts people, if this shutdown were to continue into the next week and week following, and like you said, the previous shutdown was 35 days, what do you see as the projected impact on the people of Massachusetts as the shutdown?
Oh, it will be devastating. And my team and I are already working diligently to make sure that we are meeting people in community where they are to answer outstanding questions about how to, lessen and mitigate this harm and how to help people navigate. There are a number of mutual aid efforts that I'm also a part of. The unemployment rate is incredibly concerning already. We were supposed to have new statistics from the Bureau of Labor, but we won't have those because we're in a federal government shutdown. But the last report had unemployment overall at 4.3%, and I should add for black women is at 6.7%. Black women represent 12% of the federal workforce, and as I said, have dominated those agencies and departments that were the first to be attacked by this so-called Department of Government Efficiency. So I do have an advocacy effort right now appealing to the Fed to do their job. They have a statutory mandate of maximum employment. I'm appealing to Chair Powell to honor that mandate. And then they have a specific focus on the crisis of black women because we have always been the canaries in the coal mine. And this is a devastating indicator, although we bear the brunt of everything, of harm that is going to come for everyone. 320,000 black women have been pushed out of the public and the private sector from February to August. And so I'm calling on the Fed to do their job and also to develop a meaningful plan. Because although black women are bearing the brunt of this unemployment crisis, this hurt is coming for everyone.
Is there a willingness on the other side for the bills that you're trying to pass? Has anybody shown, colleagues on the other side of the aisle, have they shown a willingness to, maybe...
Well, we just reintroduced it. And because of the shutdown, I'm not currently in Washington, but I know my team is working diligently to grow our co-sponsors for the bill. And again, I don't want us to misrepresent, but yes, we have had some bipartisan interest, and as well we should, because these federally contracted workers reside in all of our districts. So again, there should be nothing partisan about this, so stay tuned. Any other questions? Okay, thank you all for joining us.